now in our local communities. Komen helps women who can't afford mammograms to get the life-saving screenings. Komen is also behind several programs that support survivors as they make their way through treatment.
Right now, there are close to 5,000 people signed up to participate in the run or walk on Sunday, and we invite you to join us. You can register in person beginning at 6:30 Sunday morning. The run begins at 7:30. The walk takes place at 9:30. You'll find more information under Race for the Cure. There's a tab on KMTR.com.
Komen was instrumental in creating Oregon's breast and cervical cancer program. It helps low-income women who are diagnosed get access to treatment even if they can't afford it. That program helped Julie Steele. Julie was diagnosed with breast cancer earlier this year after finding a lump during a self-exam. Julie's just 38 years old and she had no family history of the disease. She underwent surgery and chemo and even shaved her own head when she started to lose her hair. But she says she had a lot of support to get through her fight, and the state's breast and cervical cancer program helped ease the financial burden.
How is this going to work? What am I going to do? How am I going to survive? You know, all of that. And it was just one less thing that wasn't even on my plate. I didn't even have to worry about it, didn't have to be concerned about it, didn't have to ask any questions. It was just done.
Dr. Winnie Henderson was the surgeon that removed Julie's tumor. She says it's very common for younger women with no history of the disease to get it. And she says that's why self-exams are so important for women and men.
For men to check their breast, which is just feeling their chest wall, it's also important. Actually, breast exam is actually very simple. You can do it anytime in the shower when you're laying in bed. It's pretty simple. Just be aware.
During Julie's treatment, her friends rallied around her and bought her all these crazy pairs of boots. She had a pair on when we interviewed her. She wears them regularly, reminding herself that she is strong and that she kicked cancer.
Good for her. I like that. Earlier this year, Governor John Kidzopper signed Senate Bill 433 into law, which closed a loophole in the state's breast and cervical cancer program. It means that low-income women in Oregon who are diagnosed with breast or cervical cancer will have access to life-saving treatment even if they are diagnosed by a physician outside of the state's program. Supporters of the bill say women should not be penalized for receiving a diagnosis outside of a particular program. The important thing is that they get the treatment they need.